Assalamu alaikum. Today I am presenting the Modified Jackson Rees anesthesia circuit, a commonly used breathing system in pediatric anesthesia due to its simplicity, lightweight, and very low resistance to breathing. This circuit is actually a modified form of the classic AIRS T-piece, designed specifically to give the anesthetist better control during both spontaneous and assisted ventilation. For infants and small children, the circuit consists of three main components: the fresh gas inlet, the patient connection, and the open-ended reservoir bag. Fresh gas from the anesthesia machine enters through the inlet and flows toward the patient. When the patient takes a breath, they inhale directly from this fresh gas stream, which helps reduce their work of breathing. A major advantage in small pediatric patients whose lungs are delicate and require minimal resistance. During exhalation, the patient breathes out into the circuit, and the exhaled gas moves into the reservoir bag. This bag plays a very important role. It allows the anesthetist to see the patient's respiratory pattern clearly by observing the movement of the bag. It also enables easy manual ventilation by gently squeezing the bag, providing controlled breaths when needed. The open end of the bag ensures that excess gas escapes safely, preventing pressure buildup inside the system. Because the Modified Jackson Rees circuit has no valves, it remains extremely lightweight and responsive. This makes it ideal for situations where constant monitoring and fine control of ventilation are required, such as during short pediatric procedures, induction of anesthesia, or patient transport within the hospital. Its design promotes smooth breathing, quick adjustment of fresh gas flow, and effective manual control by the anesthetist. Overall, the Modified Jackson Rees circuit is valued for its simplicity, speed of setup, excellent visibility of breathing movements, and suitability for pediatric airway management. It remains one of the most reliable circuits for safe, controlled ventilation in infants and small children. Thanks for watching. Do subscribe for more videos.